Welcome back to Motivational Mondays. Today I wanted to take a moment and just step back and kind of talk about my treatment and business philosophy. And what I mean by this is at Medicine by Movement, Wellness, and PT, I am trying to take more of a preventative stance. My goal is to optimize your movement now, but also kind of look at longevity of your health. And why I bring this up is it looks a little different than what we are used to with traditional PT in an insurance-based world. Normally, if you, let's say, had some knee pain, you would go to your doctor, you would get a referral for physical therapy, and you would come in, the physical therapist would evaluate you. And there are some wonderful PTs here in Sitka. We are very blessed in that manner. And so they may or may not see some other contributing factors. But when insurance is involved, if they discover, oh, you know what? Actually, I think your back is at play here as well. Insurance is going to make you go back to your physician, get another referral for that other body part. And we're really supposed to focus on why you were referred to PT in the first place. So looking at that pain generator. And usually PT can take care of that. Now, unfortunately, it is very rare that if you have knee pain, that the knee is the only issue. Things where this is not the case are big surgeries. So like if you had a total knee replacement or a rotator cuff repair, those are very specific, right? You know exactly what the surgery was. Unfortunately, that's a longer rehab time. So you're looking at 3 to 6 months of PT, a year of rehab before you're at 100%. Those are perfect injuries or surgeries to follow traditional physical therapy. So using your insurance, you don't need a movement detective to figure out what's going on. There's a very specific protocol and you follow that. PTs are needed to make sure that you're doing it appropriately and progressing appropriately. But that's the perfect time to use your insurance. Now, I'm more than happy to see these patients, but to pay out of pocket for that long of a rehab, that's where it makes sense to use your insurance. If we step back and we think about that knee pain patient, so with my philosophy, my go-to is discovery, foundation, transformation. And what I mean by that is if you came to see me with this knee pain, we would go through an evaluation. And during that time, we'd sit back and we'd really talk about your goals, what you want to accomplish, why this is important for you to fix. And that's different for everyone. And when you come in, we sit down after the goals and we go through a very detailed movement assessment and evaluation. And so that discovery phase, we are, number one, finding what's the pain generator. So let's say you have patellofemoral syndrome in the knee. We're going to take care of that pain, obviously. But we're also looking at what's the root cause, what's contributing to this. Is it some foot and ankle weakness? Is it something happening at your hip? And we're really going to dive deep to figure out what that is so this doesn't continue to come back, right? A lot of people can treat the pain and make you feel better for a little bit, but you don't want to keep coming back to PT forever. So the discovery phase, that's usually a few visits to take care of that pain generator and really figure out what's causing the issues. The foundation, now we're retraining the body. So a lot of those root causes are compensation patterns, things that we've developed over time. And you really have to spend some time and lay a really firm foundation, retrain your body to move the right way. And that takes different amounts of time for everybody, but usually at least a few visits there. And then we get into transformation. And this is where we dive more into your strength training, optimizing performance, things of that sort. And this looks different for everyone. And this is where really diving into the goals makes a big deal, because if your biggest goal is just to get back to work in normal ADLs, that's going to look a lot different than the person that wants to run a marathon, or the person that has a little one at home and they have to be constantly squatting down and getting on the floor with their child. You know, it's going to look different. And I think it's really important for us to figure out what it is we want and what's important to us, so that we can really make that transformation and get you back to doing what you want to be doing. And then where traditional PT then sends you out the door, I would love to see physical therapy embrace this change, but prevention or maintenance therapy it's a bad word. Insurance does not like that. They don't reimburse for that. And I don't know why. I mean, we do this with your dentist. You go in for cleanings at least once a year, usually twice a year. We see our doctor once a year. Why don't we do this for movement? We could prevent so many injuries and prevent so many visits to physical therapy in the future, or orthopedic surgeries, if we got ahead of that, if we looked and found those movement patterns that were potentially going to cause an injury beforehand. And this is where I love my business, is a lot of my patients are joining memberships. So after we go through a plan of care, things are feeling much better, they're choosing to stay on once a month. And they come in. If they're feeling good, we just take their exercises to the next level, and I give them more things to work on. But I can think of a couple patients that, my one guy came in with rotator cuff impingement. He wanted to get back to softball. We got him back. He was doing great, and he decided to come through my membership program and continue to come once a month. And not only have we improved his strength and mobility for softball, but we've discovered a couple other issues that probably would have continued to progress, an Achilles tendonitis, and then a wrist issue, that both of those we were able to treat with one visit, give him some stuff to work on, and they didn't become this bigger issue. And that's where I would love to see our profession go. Do more of this preventative care, and really get people moving the way that they should. So that was a very long-winded explanation of my philosophy, but I hope that this motivates someone that, if you've been noticing something that maybe is not moving right, go take care of it now before it becomes a huge problem and a big injury. All right. Happy Monday. Go enjoy that sun.